I'm Sharon Phillips. I'm a nurse practitioner. I'm also a nurse prescriber, but I also manage the practice, and I work at Brownhill Surgery. Yeah, we've been using EPS version 2 since, for about the last 6 months. Prior to that, we were already doing repeat dispensing. I think if you want some tips to be organised, to be able to do this smoothly, it's to get a lot of your patients synchronised, get most medications synchronised, get the medication review dates running alongside when you actually do want to see the patient for any sort of review that is due, any chronic disease follow-up, such, for example. And also, you know, the authorisations of how many prescriptions are allowed, get them all running together so the whole thing is synchronised, and then you find the actual transition to doing repeat dispensing and then into EPS version 2 will be a lot easier. I think you also need to look at the actual process that you have in your practice for generating the prescriptions. It may well be you have admin staff doing a lot of the generation of repeat prescribing, but who actually deals with any acute requests and who deals with any queries. Because what we found initially, we have 2 nurse prescribers in our practice, so a lot of the acute requests or queries go through to the nurses who deal with the query, but they don't actually sign the prescription, they just generate the prescription. And we also have somebody in admin who may be generating a repeat prescription, so it then became confusing because we had 2 parts of the prescription that could be in different bits of the building. So we actually had to backtrack in the system that we were doing, and if there was any query or anything on a prescription, and then it was only ever dealt with by one person. So that's something just to think about, depending on what the system you're currently running your own practice.